Hello, Namaste viewers. Welcome to our channel Physio Healer. I am Dr. Nisha from Physio Healer, and in today's session I am going to talk about what is assessment, subjective assessment and its importance, what questions to ask while taking subjective assessment, interpretation of the information gathered after taking subjective assessment, and some tips for patients to get the best outcome from physio assessments and appointments. Starting with what is assessment, its meaning and its importance. The word assessment is mainly used with two meanings in literature. One meaning is examination and the other meaning is evaluation. Examination is either subjective or physical in process of gathering information about the patient and their symptoms, whereas evaluation is a thought process of the therapist about what he is doing, why he is doing so, how justified, suitable, rational, effective and logical the processes are. These two processes generally go together hand in hand. The word assessment can be used to describe the total process of examination and evaluation. What do we look for in the examination process? So first thing what we look for is what structures are at fault. So those structures can be joints or structures around a joint like ligament, capsule, intra-articular structures like menisci, intra-articular disc, ongoing intra-articular inflammation or degeneration, other soft tissues like muscle, tendon, bursa or fascia, peripheral nerves due to adhesion, bleeding, entrapment or extraneural, perineural and intraneural pathologies. Second thing what we look for is what is the stage of the disorder. Under that we should look for the frequency of the attack, the symptoms whether they are localizing or spreading, in the light of inflammation and its stages, where do the present signs and symptoms sit? How stable the disorder is? How easily the present signs and symptoms came on? Were there any predisposing factors? Fourth thing what we look out for is factors affecting the behavior and course of the disease. How was the onset? Age, general health of a patient, gender, occupation and family history. Fifth thing what we look, how the structures at fault became faulty. What was the reason behind that? That can be trauma, disease or inflammation, degeneration process, misuse, disuse, overuse, new use or abuse of the joints, muscles and other soft tissues and peripheral nerves. Sixth thing what we look out for, what is the underlying pain mechanism for the symptom production. That can be a nociceptive pain, that can be mechanical in behavior, inflammatory, ischemic, peripheral neurogenic pain. It can be centrally mediated pain or it can be autonomic pain, affective pain. Seventh thing what we look out for is what is the patient's perspective about her problem. For example, environmental perspective, behavioral perspective, emotional perspective or psychosocial perspective. When these evaluations are done in the course of the treatment, so they are done after the initial examination, at the beginning of each treatment session, during the performance of each treatment techniques, after each technique is performed, at the completion of a single treatment session, at the next treatment session with emphasis on the last 24 hours after last treatment, as the retrospective procedure to confirm the real improvement as a result of the treatment, to find the reason behind any delay or stop in the rate of progression, to explore the scope of spontaneous recovery, to rethink about the goal of the treatment, as in many cases the initially decided goal may not be achievable, to analyze the assessment after the completion of the entire treatment, or to decide the prognosis, to determine the prophylaxis or to determine any new recognizable pattern of illness behavior. Those are the signs and symptoms. Now your job as a physiotherapist is to conduct a conversation with a patient across from you in a way that inform future treatments or recommendations. So when you conduct a subjective interview to your patient, make sure to introduce yourself first before launching into a barrage of questions. Taking a time for a simple introduction will put your patient at ease and set their expectation for the evaluation. So first question to ask to your patient is, what brought your patient here in the clinic? So when you ask this question, your goal is to direct them to explain why they have come to see you. You should have a good idea of why you are seeing them. And it's good practice to ask the patient this. Second question to ask to your patient is, do you have any history of this type of pain or other possibly related injuries? If your patient has come to the clinic for back pain, you will want to know whether they have had back pain all of their life or whether this is the first time they have experienced that. Asking this question will help you understand the onset of pain and ascertain how long the pain has persisted. Third question to ask to your patient is to tell little bit more about the pain. So when do you notice it the most? Do you experience any problems in standing, sitting, walking or lying down? So after getting an idea of the history of the problem, therapists would like to inquire about the functional activities that the patient is struggling to do. So this will help a therapist to create a specific plan of care focused on helping the patient to reach the functional goals. Fourth question to ask to your patient is, can you point to the area? How would you describe the pain or feeling that you are having? So whenever possible, document the patient's description of pain with the specific qualities such as dull pain, aching pain, sharp or throbbing pain, and always be sure to ask if they experience any numbness or tingling sensation along with pain. Try offering a scale of pain of assessment, like how would you rate your pain on a scale from 0 to 10, that we call it as NPRS scale, numerical pain rating scale. Fifth question to ask to your patient, have you had any previous treatment for this particular issue? For example, physiotherapy treatment, any injection if the patient has taken, or your patient has undergone any surgery and did it help? So asking this question will reveal whether or not the patient perceived any benefit from the past treatments. So that does not mean you should avoid certain treatment just because the patient said it didn't work. Rather, the answer will reveal that the patient is expecting, especially if they have had physiotherapy in the past. Maybe your patient will say, I have tried exercises, they don't work. Or something more general, like nothing helped at all. Remember, you are treating a person, not just their pain. So it's important to understand how the patient is perceiving and approaching their treatment plan. So try to keep the outlook positive and the patient engaged with the current treatment, no matter their opinion on the previous attempts. Sixth question to ask to your patient, have you had any imaging done like X-rays or MRIs, and what did it show? So this question is to ask to not just that you can read or see the actual imaging, although at times it is helpful to see the report or summary, but rather the objective is asking this question is to understand the result of the X-rays or MRIs. Seventh question to ask to your patient is, are you currently taking any medications for this pain? How many medication your patient is taking? How often your patient is taking the medication? And knowing the dosage of the information of a patient's pain medication can inform the treatment plan by helping you create a specific goals. So this way, instead of aiming to merely lessen the pain, your plan of treatment can indicate an objective measure such as reduce the need for the pain medication by this much amount. Eighth question to ask to your patient, have you noticed any other changes in your health like night pain? Have you had fever, chest pain, bowel or bladder changes? So your patient's answer to these questions might raise some red flags and indicate a larger problem. So depending on the patient's feedback throughout the treatment, you might choose to recommend other provider based on this initial information. Question number 9 to ask to your patient, is there anything else I should know about your overall medical history, like if your patient has cancer, high blood pressure, diabetes or surgery? You would be surprised by the relevancy of this question. So often at times a patient will come into clinic for say ankle pain, having had surgery a couple of weeks ago for hernia or hysterectomy. So although that surgery was unrelated to the ankle pain, it could directly affect your treatment plan. Unless you ask this question, you might never know about it. Although we can't always catch everything, asking this question will prevent major issues from going undetected. Even if it is unrelated to the patient's therapy needs, this information might impact the way you provide the treatment. You may need to protect that area or avoid specific movements or exercises that could disrupt it. And then last question to ask to your patient, what are your goals for the therapy? Are there any activities that you want to return to? So these return to activities phase are very important for your patient because that is your patient's expectation from you. So you will get all sorts of answer to these questions. Some people might become really specific and others will try to be funny and talk about unrealistic goals and they are never done before, such as run marathon. So what is the recommendation of mine? This is to bring the conversation back to the functional activities that are related to their main problems. For example, if they have back pain, one of their goals might be to reach down to the ground and pick up items without experiencing sharp pain in their back. So such a specific daily task is a great functional goal to work into the plan of care. What do we come to know through these procedures? So each procedure provides us information about our assessment. For example, through body chart, we can come to know about type, area, depth and quality of each symptoms, presence of any abnormal sensations, relations between the symptoms. Through behavior of symptoms, we can come to know about aggravating and relieving factors for the pain, severity, irritability and nature of the pain, 24 hours pattern of the pain and stage of the condition. Through special questions to be asked for the subjective examination, we come to know about to exclude any existing contraindications and precautions, history of the present conditions. Through that, we can come to know about onset of the symptom or onset of the disease, changes took place over the period of time for the current condition. Through past medical history, we can come to know about underlying medical illnesses, previous attacks and effect of the previous treatments. Through social and family history, we can come to know about patient's age, gender, work and home situations and insurance if your patient is having. Interpretation of the information gathered during the subjective examination. So information sought at the beginning, for example, how the information was gathered. For example, for patient's abilities and inabilities, we gather the information about social and family history, severity, irritability and nature factor, and the behavior of symptoms from the body chart. Remember that the pain is not the only symptom. For the patient's perspective on their problem, we have to go through the social and family history of the patient. We also have to go through the past medical history. For structure at fault, this includes the area, its state of healing and probable pain producing mechanism. So initial suspicion about the structures at fault that we can come to know from the body chart. From the onset under the history of the present condition, from history of present condition, from referred pain patterns sometimes which give the further support on the initial thought. From body chart by the relation between the symptoms, from aggravating and relieving factors, we can come to know about the state of healing from the history of present condition, probable pain mechanism from the body chart, for example, VAS scale, visual analog scale, and the nature of pain. From contributing factors which might have been responsible to produce the symptoms, so this we can come to know from the history of present condition, from aggravating and relieving factors, from past medical history, from the analytical thought which is used to plan the physical examination, and here remember making the feature fit. So any underlying precautions or contraindications from the special questions we can come to know. From the management strategy and treatment plan, we can come to know from the body chart. Symptoms and their distribution, relation between the symptoms, from referred pain patterns, from severity, irritability and nature factor, from social and family history, we can come to know prognosis including the frame and expected recovery from the patient, from the stage of disorder under the behavior of the symptoms. Some tips for the patients whenever they visit a physiotherapist to get the best outcome from them. So first thing to remember, dress properly. So physiotherapists will definitely want to see and touch the skin over the injured or painful area. So they will probably want to get their hands on the areas just above or below this too. So prepare yourself that way as ahead of time and ensure that you are appropriately dressed or be armed with the right layers. For example, if you are being seen to treat your shoulder, be prepared to slip off your top or wear your outfits accordingly. About your symptoms. An extremely valuable part of the assessment of any condition is a thorough analysis of what makes it better or worse. This enables the therapist to clearly diagnose the problem but also to set the irritability levels. This gives the therapist a better idea on how much they can do in a session without potentially making you sore afterwards. Not being able to clearly identify this means the therapist has less information to make these decisions on and is therefore cautious in the treatment initially. It may also mean that they need more time to delve into these things. Have a good think about your symptoms, write them down if possible, and bring them to your appointment. Some things to think about and even write down are: first, history of the problem. When did it start? Is it the same, getting better or worse since it started? Is it the first time of having this problem? Have you had any investigations like blood tests, scans or x-rays? Any previous treatment? Have you had any medical treatment or other treatment, that is another physiotherapy treatment? And what things make the problem worse and what things make it better? Do you have more pain in the night or first thing in the morning? What medications are you on? Take a list with you to the physio. Do you have any other symptoms like pins and needle sensations, numbness, sweating, giving way or locking? What would you like to get back to doing when the problem is stopping you from doing now? So this gives you time to think about the answers a little before you get there and making a clearer assessment of how much you are able to do. For example, if walking stairs up your knees complain, you may monitor it to see approximately how much you can do before it starts. When it starts, after certain walking patterns or after walking on different terrains. Be honest about your homework. Everyone struggles to start new routines. If your therapist has given you some new exercises to treat your condition and you know you cannot fit them all, and as they take you over an hour to complete, then you must say. Saying you have done them when you haven't will potentially reduce the therapist's confidence in their diagnosis. So as they would have expected you to improve within certain time scales. Conversely, not doing them means you won't see the benefits attached. So be honest. Get a short, succinct program for you that is manageable. Talk over the difficulties with you can't fit them in. So as your therapist will have a million ideas about how you can fit them into your usual routine that you may not have thought of. These 3 tips are quick and easy for you to do and will add an increased value to your physio sessions, meaning you get way more from it. So recover well. If you have any questions or suggestions for us, you can write down in the comment section below. We'll try to reply as many as we can. Thank you for watching. See you soon next time. Stay tuned. If you like today's video, don't forget to like, share and subscribe us.